We need to walk out of these doors after this overall event, geared up for action and ready to hold someone accountable. I mentioned that I work for the World Bank. Last week we had our annual meetings in Bali, Indonesia, and something terrible happened in Bali. The World Bank released the Human Capital Index, the Olympics for health and education for all countries. Out of 157 countries, we were in the same league with Somalia, Chad, and Niger, and such other countries. Things were never like that. A bit about me. What I do is I wake up in the morning thinking, how can very skilled surgeons, physicians, Mr. Kokar, and several of the people you've seen, not to be able to deliver care to the people living in VI, Ikoyi, who can afford, like the lady asked, but how they can deliver care to those who are poor and vulnerable. If we have not been able to do that, we have not succeeded. If we are unable to use the skills, capabilities, and abilities in the private space for those who are left out, then we have a problem. Why is all of this important? Because in the context of universal health coverage, you are juggling three balls. First, how many people? Second, what is the package you're giving to them? Third, how much money do I have to do all of these things? If you are ambitious and you say, look, I want to give everybody health care, it means that you need to think beyond the number of doctors, nurses that you have. It means then you also need to take people who are anywhere in the world. Look, we're thinking big, we're transforming, you need to come home. It's been done before. The India magic started in 1983. For those of you who do not know, please check out the history of Apollo Hospital. Dr. Reddy approached the president of India at the time. I want to set up a first-class hospital in India. The president at the time, Prime Minister, gave Dr. Reddy a piece of land, concessionary financing, and everything Dr. Reddy asked for, the Prime Minister, I think Rao also, gave to him. By 1984, Apollo Hospital was up and running. But what was unique about Apollo Hospital? Several of the doctors in Apollo came from the diaspora. And that first hospital, first corporate hospital in India, began the India magic. Let's look at a few numbers. We have all these numbers in my institution, but let me share some of them with you. Heart surgery in India is very cheap now. When I say it's cheap, it's cheaper compared to doing the same thing in the United States. However, the price point is good to bring in Nigerian kids. Let's look at cardiac surgery, because most of our kids that require heart surgery end up in India. Yes, it's cheap, but the Indians are not looking for cheap. They are to some extent, but there's something more important that happened in the process. You then have today much more cardiac surgeries happening in India than in the United States. Imagine that those kids requiring heart surgery were here. It means you will train more doctors. It means it will be cheaper. It means you will improve the system. The Indians, they're using us for very good reasons, and everybody is copying the India model. Let's use Nigerians, the Turks, the UAE, Egypt, South Africa. Oh, maybe you don't know. We are now going to Kenya and Ghana. If you have a need for treatment in cancer today, you're going to go to Accra. You will need between $10,000 to $15,000. But your money will not get you through the Swedish Ghana Medical Center because you have to queue. So, if people go abroad, get treated, you are not only improving the skills of those there, you are improving the economy, but you are also leaving out those who cannot even raise money to go abroad. How do we pull you back? And I discuss pulling you back not just in the context of those who want to come back, but in the overall context of even those who are here who wants to get things done. Again, let me say up front, money to invest in things is never the issue. Money is not the problem. There's no need to reinvent the wheel. How did India do it? India gave concessions, right? Land, this one, that one. Dr. Lo will come. Can we replicate an healthcare incentives policy document? And thank you for that. And I think she mentioned to me just now that the Minister of Health will be taking this to the Federal Executive Council in a few weeks. But I want to hold you accountable because you need to hold her accountable so that ask her, call her, email her. Is this document done now? It's important. Second policy document, PPP policy. Because you do not necessarily need to start a greenfield investment. You may want to partner with an existing public institution. That might be an easier way to make an investment. That also speaks to things that can bring people back or can facilitate investment around here. There are several other things in the policy space. Let me talk about financing. I say all the time, and people hold me and push me and say, hey, you say all the time that there is money. And I said, so yes, there's money. Either the diasporan physician or the physician here, oh, how much do you need for your investment? I need X amount of money. Can you please share with me your business case? There's no business case. There's no business plan. Here, I'm speaking directly to you. There needs to be a plan. You need to think through it. But you're in a strong position because if, for instance, the kind of investment you want to make is large enough and you have different investors coming in, an investor sitting in London, Geneva, or wherever also want to know who are the people that will man that institution. So Nigeria needs you both ways, either for someone investing here or investing from overseas. I spent 3 years of my life doing this. I managed a large project. It's still the largest healthcare project in Nigeria today. In fact, it's 5 minutes away from here. As at the time I left the project, it ran into several millions of dollars. And those are the kind of questions people who want to invest will ask you. Who are the people that will run the hospital so that we can safeguard our investment? So that you are aware, that hospital is not functional yet, despite all the investment, because several things are missing, and I'll speak to that in a short while. For record purposes as well, the first investment the International Finance Corporation made in Africa is in this town. I doubt if anybody in this hall know where it is. I doubt it. Show of hands. International Diagnostic Center. If you know Utako Market, at the time it was built, one of the biggest hospitals on the continent. It ran for 1 year. Go take a look at it. It's a brick building. About money, there are several other things that are missing. And I then very quickly talk about one critical thing that needs to be in place. Someone used the analogy of demand and supply side. Yes, I focus on demand side. And several other people have talked about the role of risk pools. Because I work with the World Bank, I'm not so much interested in private health insurance. Because if private health insurance can go to scale, it would have done so, which was what Mr. Coker was talking about. Without public money being used to buy services from either public or private, we're talking grammar. But there's been movement because of all your efforts. We have today in the budget of the Federal Ministry of Health, I see Dr. Lowe, I see Dr. Azodo, and maybe other directors in the Ministry of Health. There's $150 million US sitting in the budget of the Ministry of Health today for the implementation of the Basic Healthcare Provision Fund. I don't know if you've started drawing down on that money, but it's money that needs to be spent between now and December. Is money the problem? That money, by the way, and you can calculate it by our estimates, if the price of oil goes up and all of that, it means that pot can even grow bigger. It then means that we need to look for creative, innovative ways to access such monies. And that's where I come to you, Dr. Bagudu. If the BHCPF takes care of primary care services, right now, less than 5% of people with cancers simply go home and die. The worst part of it is that before they die, they go into penury. Mr. Coker alluded to that. So you die and you go broke, and then the family has nothing. But there are solutions, there are things we can do. And I take the example that Senator Tejo has. Let's cost, for instance, the 3 top cancers: breast, cervix, prostate. Let's price each one. If it's 100,000, if it's whatever it is, let's put the money aside. Whoever can provide the services across the 3 treatment nodes, surgery, chemo, radio, and we buy services based on the money we have put aside. It is not rocket science. There are a couple of things that will come from that. It will even facilitate a lot more investments. It will allow our doctors to be better trained because they do more procedures here. But more importantly and significantly, those who are poor, vulnerable, cannot afford health care, will have access. Oh, and those who are rich would not want to go to India. They will be here. And you can price those ones as appropriate. Your Excellency, my last 2 minutes was dedicated to you. There are too many people dying from cancer. And I'm happy you're here. We need your advocacy to make this happen. For those who are planning to either make investments, this, I think, is the time to take advantage of what's called the first mover advantage. And last point from me, one, the Central Bank of Nigeria has two instruments. There's something called the MSME DEF. It's priced at less than 2%. It has the RSSF, similarly priced at the level of CBN. The Bank of Industry has cheap money as well. The Sovereign Investment Authority is prospecting for partners. We are too, on a smaller scale. But what we have is too small compared to what Nigeria as a country can do. I have it on good authority that the Human Capital Index, of which we did so poorly, seems to be making an impact on the leadership of the country. So maybe this is the time to forge ahead with all of those plans that you have.